Hello everybody, I'm Carine Courtillot. I'm an endocrinologist. I work in Pituitary Hospital. It means that I'm taking care of glands and hormones. Okay, so in Erdheim-Chester Disease there can be several endocrine manifestations, and so I'm going to tell you what are the glands in the body and what their function are and what can happen if there's a problem with Erdheim-Chester Disease. So the first gland is the pituitary gland, which is in the brain, and it's a very important gland because it produces hormones. It produces hormones that regulate the other glands in the body. The thyroid, the adrenals, the ovaries, the testicles, breasts, and it also regulates growth. So there are two parts in the pituitary, the anterior part, and there is also a posterior part here that produces the antidiuretic hormone. And like its name says, it's a hormone that prevents you from urinating. So if you lack this hormone, you urinate a lot, and then you're very thirsty and you have to drink a lot in order to maintain your body's hydration. And this deficit in posterior hormone, posterior pituitary hormone, is called diabetes insipidus. The thyroid gland is here in the neck, and it's a gland that secretes hormones that regulate many of the metabolic processes, including growth and energy expenditure. It's very important. The adrenal glands are two little glands that are above the kidneys, and they produce very important hormones for coping with physical stress to body and maintaining adequate blood pressure control, blood volume, and salt retention. These hormones, maybe some of them you've heard about, are cortisol, which is, you cannot live without this hormone, aldosterone, which regulates blood pressure, salt retention, and very importantly, general well-being. There are also mildly potent male hormones that are produced by the adrenals, and adrenaline and noradrenaline. The gonads, so ovaries in the female and testicle in male, have two functions. They secrete the sexual hormones, estradiol and progesterone in women and testosterone in men, but they also produce the gametes that ensure reproduction, like oocytes in women and spermatozoid in men. So now you've seen all the major glands in the body and what their main functions are. In Erdheim-Chester, there can be infiltration of all those glands and dysfunction of all those glands. The pituitary is often infiltrated, the testicle, the adrenals, and also thyroid and breast can be infiltrated. And all those hormonal dysfunctions are very frequent and have important implications like diabetes insipidus, fatigue, head rush, excess body weight, low muscular strength, impotency, infertility, depression, mood changes, increase in cardiovascular risk, and bone demineralization. In the patients that we follow in endocrinology in Pituitary Hospital, we have found that endocrine manifestation and particularly hormonal dysfunctions were very, very frequent. In our cohort, only one patient did not have any hormonal disturbance, but he had infiltration in his glands, so maybe those deficits will appear eventually. The most frequent deficit is growth hormone deficiency. So in children, everybody knows that growth hormones is mandatory to grow normally. In adults, growth hormone regulates metabolism. It has a very important role in cardiovascular risk, lipid profile, blood glucose level, and also it plays an important role in body composition. If you have growth hormone deficit, you will have less muscular mass and more adipose tissue, more fat mass. And also, if you have a growth hormone deficiency, your bone will get demineralized. Testicular deficiency, we were surprised, but it's very frequent in Erdheim-Chester disease. Half of the men who have Erdheim-Chester disease have a testicular deficiency. They have infiltration of their testicle, and they have a low production of testosterone with lots of problems like bad libido, no erections, bad sex life. A third of the patients have diabetes insipidus. There is also a gonadal dysfunction in women and in men that comes from the pituitary. So the lack of testosterone doesn't come from the testicle, but from the pituitary being infiltrated. So in men, the lack of testosterone in men is very, very frequent in Erdheim-Chester disease, both from testicles and from pituitary. The thyroid deficiency, either from the thyroid gland or from the command from the pituitary, is seen in 20% of the patients. The cortisol deficiency is much more rare. Diabetes insipidus is often one of the first signs of Erdheim-Chester disease, even before all the other signs you've heard about, and very often the first endocrine manifestation. And once it's present, it's permanent. What is important to know is that new deficits can appear along with the follow-up of the Erdheim-Chester disease, so it's very important to regularly assess all those deficits. Also, I told you there can be an infiltration and maybe a destruction of the testicles. So in men, we have seen alterations in sperm count. So I think it is very important for men who have a parental project to have a preservation of their sperm as soon as the diagnosis of Erdheim-Chester is made. This is just to show you how frequent the anterior pituitary deficits are. You can see here that more than 90% of the patients have at least one anterior pituitary deficit, and 70% of the patients have at least two anterior pituitary deficits. So it's really something that we see all the time in patients with Erdheim-Chester disease. So I think it's very important that patients that have this diagnosis be seen by endocrinologists as soon as the diagnosis is made, and be regularly seen for the assessment of new deficits and for the substitution of the deficits that have been diagnosed. All the anterior pituitary deficits can be treated with natural hormones, substitutive hormones, as well as posterior pituitary deficit. Diabetes insipidus is very efficiently treated with vasopressin. So it should regularly be sought for clinically. A pituitary MRI should be performed regularly, and hormonal evaluations must be done at least once in hospitalization, because there are dynamic tests that we perform in endocrinology that need hospitalization. The gonads, especially in men, have to be examined. We have to look for testicular nodules, and it's absolutely mandatory that men have a testicular sonography and proposition of sperm cryopreservation if there is a parental project. And of course, the gonadal function must be evaluated hormonally. The thyroid must be also clinically examined, and if there are lumps, nodules, then a thyroid sonography is important, and also the blood check. For adrenals, it's the same, and you have to look for clinical signs of adrenal deficiency, even though it's very rare. And the adrenals must be looked on the adrenal CT, and the adrenal function must be evaluated. We have also to look for lumps in the breasts in men and in women, because both can have an infiltration of their breasts. And metabolism must be very often assessed: blood pressure, electrocardiogram, blood glucose, lipid profile, because the cardiovascular risk for many reasons is very high in Erdheim-Chester disease, because of the disease, because of the treatments, because of the pituitary deficits, because of the hormonal substitutions, because of the metabolic dysfunctions. So it has to be really well assessed. Thank you.